Good afternoon, everyone. We are 1 minute in, and we're going to get started with today's webinar. Hello, my name is Rupam, and I will get us started today. Welcome to the fourth annual HSITAG special event, this year in the form of Are You Smarter Than a Fifth Grader? We've done this several times, and very excited to bring this to you this afternoon. For the game show today, we have a fun lineup of health and human services, technology-focused questions, crowdsourced from wonderful professionals such as you and, of course, AI. Three very engaging teams comprised of federal partners, state and local agency folks, and new this year, individuals from our industry alliances. And three very worthy charities that will benefit from today's gameplay. So let's get started. And before we do that, I want to remind you that we'll be talking about emerging technologies that can shape the future of humans while we make this fun, engaging, and impactful. With that, I will hand it off to Gary to talk about his impact.
Well, I just want to start with a big welcome and thank you. This is a great annual event, and for me and for this event, it's all about community. I want to start with a big thank you to our federal, state, local, and industry partners. You're going to see some great gameplay. We have some great panelists, so a big thank you for the commitment, and we're going to have fun. So what we hope to do today is, frankly, raise your spirits, right? Have a good time together as a community, but equally and maybe more important, raise money for three worthy charities. And the charities that were chosen were from the three panels. So can't thank you enough. So with that, Rupam, let's get it going.
All right. So those of you who are joining us for the first time may ask us, what is Are You Smarter Than Fifth Grader have to do anything with HSITAG? The goal is kind of twofold. First of all, we want to explore technology and programs and connect them to real-world health and human services use cases. So that's number one. Number two, share best practices, concepts within the programs that we serve without having to make it sound like a lecture. So I hope we can all learn a thing or two from today's gameplay. Three teams will be playing to win up to $1,000 each for a charity of their choice. But at HSITAG, everyone's a winner. So we will maximize donations and we'll go from there. So let's start with a quick introduction of our teams. All right, the first team we have Impact Mavericks. They are playing for a charity called Down Syndrome Connections in Las Vegas. And the team includes Ed Dolly, Darlene Bragg, and Sandra Shelby. Next team is the C Plus 3 team with Mark Bonner, Cass Madison, Jeff Jorgensen, and they are playing for American Red Cross. Next one, definitely not smarter than a sixth grader. I love that name. Rachel Stewart, Reggie Bicca, and Tangular Gray are playing for No Kids Hungry. Along with everyone else, we also want all of the participants to participate as well. So there'll be tons of opportunities for all of you to chime in, actually, for each and every question. And with that, I want to hand it off to our wonderful host, Jamie DeMabram. Take it off, Jamie.
Thank you, Rupam. Hey, welcome, everyone. So if you've been to these before, know that we take a popular game show and have our players play it with kind of a few tweaks. So if you've ever seen Are You Smarter Than a Fifth Grader, you know that the team will come out, the player will come out, there'll be a kid that they select, and then they have the classroom. Well, just for everyone that's in the audience, you're our classroom today. So when you see us going through the gameplay and you see us asking questions, a poll is going to pop up. And what we'd love for you to do is provide your answer. Because if our teams get stuck, a couple of the cheats they're allowed to do is they can peek at their classmates' answers or they can copy their classmates' answers. And today, you're their classmates. So as we go through the gameplay, there'll be opportunities for you to answer the questions while we're playing live. And then if they get stuck, they're going to ask you for the answer. So they're hoping that at least someone out there is smarter than a fifth grader. They had me host because when my fourth grade daughter brings home her homework, I already struggle. So that's why I host and I don't play. But hopefully some of you in the audience are a lot smarter than me. The other thing that we talk about today is we're going to play for charity, right? So as the players play, each one of them, for the teams of 3, are going to pick a question. Each question they get right is worth $125 to their selected charity. They're going to do 6 questions. That's going to bring them to $750. Their final question, I get to pick, is worth $250, so a grand total of $1,000. So each team is playing $1,000 today for their favorite charity. So with that, I'm ready to hop into it. Let's get Team 1, the Impact Mavericks, to come on camera for me. All righty, I see they're on camera. Let's get things rolling here. All righty, so I'm going to start with Ed. Ed, you see here that there are various questions on the board, of which we have different categories: green, yellow, red. That's just kind of the intensity of how we think maybe the difficulty of that question may be. But with that, I'm going to let you start on the board. Which question you want to select?
We'll go green, procurement.
Green, procurement. All right, let's see that question. So the first question of the day is going to be a true or false. State government agencies must follow federal guidelines when purchasing, question popped up, services for programs funded by federal grants. So while you think about that, Ed, I've got a question for you that's nothing to do with this. Based on everything I've seen in science, it says that no 2 snowflakes are identical, but you shared that you actually once held 2 identical snowflakes in the palm of your hand. Tell me about that.
As a matter of fact, I did, and it was a magical moment. And unfortunately, they no longer exist, so I cannot prove the scientific community wrong. So it's a burden that I carry, knowing that I have disproved something that everyone takes to be for sure a given fact. But I challenged it, and I succeeded in holding 2. Just like the speed of light is no longer a constant, it's no longer true. I've proven it. You can, in fact, hold 2 snowflakes that are identical in the palm of your hand.
So how old were you when this happened?
Well, let's not get into age or those types of things. I mean, that's a little personal, Jamie.
That's fair. So
that's fair.
We'll get back to the true or false. So talk amongst your teams on this one, though. What do you think? Yeah, Darlene, Sandra, what are y'all coming up with? You feeling this question's a true or false?
I'm going to go with true. I agree as well. I think this is true.
All righty. Ed, you agree? Is it everybody says it's true?
I agree. Everyone says it's true with the normal federal caveat of federal law can't overstate state law. But yes, in general, it's true.
And audience, that's why we bring Ed. We're going to go with true. Show us the answer. Nice. Yes, true it is. That's 125 in the bank for Down syndrome.
Well, I don't see why we need to continue this farce. We've obviously won.
Awesome. All right, I'm going to roll over to Darlene on this one. Darlene, you're next on the board. What category and color you want to select today?
I'm going to go with yellow, HHS workforce.
All righty. So the question we have here, it says, which of the following is a recognized strategy to reduce burnout among health and human services professionals? Is that A, increasing caseloads, because that always works, B, shortening training programs for workers, C, implementing trauma-informed care and promoting a work-life balance, or D, ignoring it, which is also another tried and true strategy. So with that, though, while you think about it for a second and let your classmates have a moment to answer, Darlene, you're a tap dancer. Tell me more about that. That was very impressive. Did I read that you actually once had a tryout with the Radio City Rockettes?
Yes. So I grew up taking dance lessons, and then my sister owned a dance school for 30 years, and I taught with her. And I was actually in New York and on a modeling gig, and my agent found out that I met all the requirements, which were pretty strict for the Radio City Rockettes, got me an audition, and I chickened out and I didn't do the audition. So I let fear guide me, and I went home not a Radio City Music Hall Rockette, but I could have, I might have had the same outcome if I had just done it. So that was the last time I let fear stop me from doing something, and I've been no fear person ever since, even jumping out of a plane on my 50th birthday with my kids.
So awesome. And two fun facts. I can't tap dance and I've never been asked to model. So you got two on me already. How about that? All right. So Ed, Darlene, Sandra, what we got here? You see the question? What are we thinking?
Well, I mean, I want to give the states an opportunity to be correct because obviously CMS has three answers on this board.
Correct, which is D in your opinion first. But Darlene, Sandra, what do you think it might be here? What is the preferred answer?
I would definitely say C, implementing trauma-informed care
Absolutely.
and promoting
Absolutely.
work-life
Yeah, I'm
balance.
going to go with C. Increasing
gotta be C.
caseloads could be fun, but no, I think C.
Absolutely.
All right, show us the answer. We're going to go with C, please. There you go. Another correct answer, another 125 in the bank. Nice job. All righty. We're going to move on to the next question. Sandra, you're up. Run us through the board here.
Let's do green policy.
Green policy. All righty. And the next question on the board is going to say, the Head Start program is a federal initiative that provides what type of services to low-income children? Is that A, higher education scholarships? Is it B, job training for teenagers? C, college preparation courses? Or D, early childhood education, health, and nutrition services? And while we give the classmates the chance to get at this question, Sandra, one of my favorite fun facts is that you were chased by a tribe in the rainforest of Malaysia. What happened?
So when I was a young adult, I went on a trip and went up on a river boat to a small town called Kapit, and I heard from my room the music of "Sweet Child of Mine" in another language, and so I just ventured off into a festival and started playing carnival games. Didn't speak the language, and my translator, they didn't speak Mandarin, so we had a communication barrier, and they've never seen anyone like me, so they proceeded to chase me down the street, and my translator screaming hello at the top of their lungs the whole way back to my room. It was great. I did end up with a little weird rabbit, a little weird stuffed green rabbit.
That's
No
awesome.
idea.
And a great story with it. I love that. Awesome. Okay. Well, so the question at hand here, you see the available answers. So, Darlene, Ed, Sandra, what are we thinking here?
I am thinking D for
You
sure.
thinking D? For sure.
For sure, D.
Yeah, pretty sure D.
I'm
It's
here.
not my program, and I don't speak on behalf of the other federal partners, which I greatly respect. I normally would defer, but if forced to give an answer, I would suggest D.
I
agree with
think
my
D as
teammates.
well. I think so. So let's see that answer. We're going to go with D. There it is. Nice. See, everybody's already smarter than a fifth grader, which also, too, if some of these questions were presented to a fifth grader, they would probably be scratching their head. All righty, back around the rotation. Ed, you're up on the board. What would you like to select?
Let's do policy red.
Policy red. All right, stepping up to the difficult ones. All righty. This question says, which type of income is considered when determining eligibility for SNAP benefits? Is that A, only earned income from employment, B, income from investments and savings accounts only, C, only unearned income such as pensions or Social Security, or D, earned income, unearned income such as Social Security, and some non-cash benefits? That is a mouthful. So while we think about this, Ed, I've got another one for you. You tell me that you're a respected Lynchburg Charred Oak Barrel Clan elder. So that just tells me that you like Jack Daniels, but can you tell me a little bit more?
I think you pretty much nailed that one right on the head. I mean, after they name a barrel house after you, I'm not sure what else is left. I've achieved life goals, Jamie. Now it's all
Absolutely.
about helping. Now it's all about helping our beneficiaries.
So awesome. Okay. Well, so for this one, have y'all got any thoughts, or is there, is this one of those times where you're thinking maybe you want to at least see what your classmates selected? What do you think? Or y'all feel pretty good on this one?
I feel pretty confident in Sandra, but I have a thought as well.
Well, we
I'm
got
I'm confident as well in D, but I'm down to see if Ed feels like we need to
uh,
see the teammates, but I'm confident in D.
no, I'm with D.
Okay. Hey, you know what? I like D as well. So let's see the answer. There it is. Great. Great job. Y'all are playing phenomenally. It's another $125 into Down Syndrome Connections of Las Vegas. Darlene, you're up again. What do you want to play on the board?
Let's go red procurement.
Red procurement. All right. Let's see what that question's going to be. The next one on the board says, under the Uniform Guidance 2 CFR Part 200, what is a key requirement for agencies using federal funds for procurement? Is that A, they must perform a cost or price analysis for every procurement action, including contract modifications? Is it B, they must prioritize small businesses for contracts under 500,000? C, they must use sealed bids for all contracts over 100,000, or D, they're required to implement a vendor rotation system for fairness. While the audience is participating, Darlene, I know that you kind of helped select. So tell me a little bit more about Down Syndrome Connections in Las Vegas. I'd love to hear just a little bit more about it.
So I suggested this charity for our team because I have a almost 2 year old grandson. He's my first grandson with Down syndrome. And my daughter and her husband have been actively participating in Down Syndrome Connects. They offer an annual convention where they do all kinds of learning experiences for parents and youth and adults with Down syndrome. So they were able to learn about ABLE accounts. They were given forums on just doctors and special needs that need to be done, assessments that need to be done in the first year. And there's all kinds of different programs that they offer adults in our community with Down syndrome, trainings, job opportunities, stuff like that. So I just think they're a great organization.
Awesome. Thank you for sharing that. That sounds like a really great organization. I appreciate y'all playing for that today. So, because we're playing for them and these questions are worth money, what does your team think? And Ed, I saw your message. I know you're a little bit frozen because you're in the office. I understand that, but I think we
Of
can still.
course.
So, what do we think on this particular question, given the available answers? Is this y'all feeling good? You wanna peek at your classmates just to see what they're doing, even if you feel comfortable?
I'm
I feel
not
pretty
feeling
good.
great. How about you, Sandra?
Not at all. So I
And
think
that's
we
why
need a
these are
I feel
rare.
cheat.
pretty good.
Well, we're still gonna. I think we should use a cheat, and since this is Darlene and she's not feeling great, Darlene, you want to use one of those cheats?
Yeah, let's ask AI.
Okay, we're gonna ask AI. So for this question, we're gonna have our wonderful AI host come on and please give us some insight into the question at hand.
Well, folks, AI is saying that under the Uniform Guidance to CFR Part 200, a key requirement for agencies using federal funds for procurement is to follow competitive procurement procedures, ensuring that all contracts are awarded based on a fair and transparent process. This includes using methods such as competitive bids, proposals, or other appropriate processes to ensure the best value for the federal funds spent. Just as any other AI probably gave you more than needed, but there you go.
Thank you for that. And just in the future, when I do Chat GPT, I need you to read it to me because that was awesome. Thank you. All right. So with that, I know Ed said he's feeling pretty good, but the two of you are like, and just like AI, sometimes it gives you way more than you need. But do you think that helped you come up with the answer, Darlene? I see you shaking your head. What are you thinking?
That was a lot to hear. So, uh, based on that, was he saying B, Sandra? You think? Ed?
It's A.
No, I don't. I
It's
don't.
A. Think about it. B is a little specific for a statute or a reg.
Right.
I don't think B. I don't. I
I
think
think
you
it's
crossed
A.
that out.
I'll
I'm
say
feeling
this.
A.
I think Ed might be right also too, and I love to reference my daughter because she's amazing. But you know, when she comes home with her homework, I'm always happy when she has an A on that sheet. So if you were asking me, that's what I would say is my
Well, I'm
thought to
gonna
you.
go with I think I'll go with A then.
Awesome. All right, we're gonna see what it says. Show us that answer. There it is. We got the A. Nice job. Nice job. And thank you, Sandra, for the hand dance. I appreciate that.
Thank you.
All righty. We're going to go. One more question for y'all to pick. And then remember, I get the next one. So go for it, Sandra. Where do you want to go on the board here?
Let's do procurement green.
Pyramid Green. And the question is, what is the primary purpose of the request for proposal, better known as that good old RFP process in procurement? Is that A, to provide direct funding to agencies, B, to solicit bids from vendors for specific services or solutions, C, to award grants to nonprofit organizations, or D, to enforce compliance with state laws? All right, Sanj, I got one more for you. Tell me about this great event that turned out to be a bit of an epic fail when you attempted a half-court shot at an OKC Thunder game.
So I am a season ticket holder and got invited to take a half course shot for some floor seats for a game. That was the win if I was able to make one within 30 seconds. Let's just say I didn't even get close. It was my best shot was the granny shot from behind the back, but I probably got 8 or 9 shots off, and most of them were an epic fail. But it was fun.
Hey, listen, the fact that you got like 9 shots off in 30 seconds is pretty good to me. So, hey, and still, again, something I've never done. So that's pretty awesome. All righty. Well, here we go. You see the final question on the board that y'all were able to select. What are you thinking? Impact Mavericks. What do you think is the right answer on this one?
Team, should we use another cheat or
They're on
what
the
are
board.
you thinking?
I mean, you got it on the board. I'm feeling B though.
Hey, I'm
Right?
leaning towards B in myself. Y'all want to go with B or C a P?
Why don't you copy what the audience is? Let's see what they're thinking. Your classmates.
Let's
Oh
do
dear
that.
Lord, a jury of our peers. This was
No,
wildly
no, no,
entertaining.
no, no, no. Just a fun time with your peers.
Oh yeah, of course.
Let's do it.
All righty. So let's go to one of the cheats and y'all decide if you want to do the peek or the copy.
The copy.
All righty. So as Sandra cheats over to her classmates, it looks like they're saying that the answer is B.
B. We're going definitely with B.
There we go.
Darlene, Ed, y'all on point with that?
Yep.
All righty.
Absolutely.
Show us the answer, B. And there it is, to solicit bids from vendors for specific services or solutions. Y'all are rolling right along. That is 750 already in the bank for Down syndrome connections. All right, so your final question of the day, I get to pick, and you know which one I'm going with, the $1,000,000 question. So if we can see that question, please. This is going to be super tough, so buckle up. The question says, what does the abbreviation MMIS stand for? Who wants to take it? Any thoughts?
I'm trying to come off mute. I mean, I'm willing to take a wing at it if folks want.
You well, you can talk like until you say that's your final answer. There's no final answer. What do you think it stands for?
Oh, I think
Oh,
Medicaid's in there.
yeah,
I agree.
I'm leaning towards this might be Ed's kind of wheelhouse. I was thinking it was Medicaid as well.
And then
Uh,
the M for
management,
there we go. There we go. See, now we're getting hotter. You're getting hotter.
information
You're on
systems,
fire.
maybe.
Yep.
I
That
think
sounds
it's on
good.
fire. That sounds
You're
pretty
on
good.
fire.
All righty. So I think as we got there, Darlene kind of got it out. So I think we're here and we're going to go with Medicaid Management Information System. Y'all feel good?
Yep.
Yes.
All right, let's see the answer. There it is. Congratulations, Team One. You have now won $1,000 for Down Syndrome Connections of Las Vegas. Y'all were great. I appreciate you playing. I hope y'all had fun. I think it was good. All right. I see thumbs up. Darlene, Ed, black screen, but I'll assume that your thumbs are up as well, and maybe not another finger.
All golden.
So, awesome. All right. Well, team one, thank you so much. We're going to have y'all drop and we're going to reset the gameplay here. And we're going to bring up our second team. So if I can have the C+3, I struggle with that every time I said it. The C+3, that's going to be Mark, Kaz, and Jeff. Y'all come on screen for me here. All righty. We're going to get the new gameplay rolling here. Jeff, you outshine me today. You got the full-on Patagonia vest and a tie, so looking sharp. And I did not do that today. All righty, y'all ready to jump into it?
Just for you, Jamie, I put it on.
It looks great. Also, I think you're in Minnesota, right? It's probably a little bit cooler than it is here in Atlanta. All righty. So we're going to get started. And Jeff, since I called you out first, let's start with you. Where on the board would you like to play?
Well, let's start out with something difficult. Let's do red HHS workforce.
Okay, nice. I like the challenging part. All right, so the first question says, what is the main goal of the Workforce Innovation and Opportunity Act, also known as WIOA, as it relates to the human services workforce? And that's going to be A, to help low-income youth and adults access job training and employment. B, to provide free college education for all opportunities through integrated service delivery. C, to fund research in behavioral health services. Or D, to mandate health insurance coverage for all social workers. And with that, Jeff, I want to ask you, because I'm a huge NFL guy as well. So you told me that you attended the third coldest game in NFL history.
Well, that is true. You know, being from the bold north, you would expect nothing else. But it was not a good day for me. My beloved Vikings lost on a late field goal attempt, wide left by Blair Walsh. But it was an experience. I can say that the beverages do freeze very quickly at that temperature, but it was a great day.
So let me ask you this question. I know people say, oh, once you get there, you get acclimated to it. But I can only imagine when it's that cold that you didn't actually get acclimated to it.
No, when it's -6 with a 25-degree below windshield, there's no getting used to that. That's just cold all the time.
That is why I would watch it from the living room. All righty. Well, so with your teammates on hand here for this first question, and again, I applaud you for going to the red first. What do y'all think? What do you think is the answer here for the main goal of WIOA? What would you say given the available choices? Or do you want to go ahead and talk to your classmates?
I do not know the answer to this question, not even a little bit. Team?
I'm leaning toward A, but I'm not 100%.
Leaning towards A too, but I am
unsure.
I'm
leaning towards A. Do we want to just go with that, or should we cheat right away?
Hey, we're the C+3, so if we have three of us leaning toward A, let's go for it.
We're going to lock it in then. We're going to go
locking it in. They're going with the answer is A, and that's to help low-income youth. Show us that answer. There it is. Nice job. Nice gameplay to start.
Good instincts.
Yeah, great instincts. I agree. All right, Kaz, you're up. So play the board. What are you feeling?
I think I'm going to bounce us back a little bit to green. Start off a little easier. Let's do procurement for green. Green.
All righty. Here we go. And the question, it's a true or false for you. It says state procurement rules always allow agencies to select the lowest cost vendor without considering service quality. And while we let your classmates think about that one, so Kaz, tell me a little bit about the science of herbalism.
Yes, I am in Vermont and training to be an herbalist in my free time. So I have 3 kids and I've just found that there's a lot of plants out there that can help them when they're sick, and sort of got into it when they were little because I didn't want to, I want to be thoughtful about what I was giving them. And now I'm just super into it. So we're often out foraging for ingredients and making tinctures and balms and all sorts of things. It's really fun.
Super cool. I'm coming to your house when I go to Vermont. That sounds pretty awesome. Cool. All right. Well, you see the question on the board and you got your fellow teammates. What are we thinking here in terms of this specific question? Do you think this is a true or false when we're talking about the state procurement rules?
I don't know the answer to the question necessarily, but I feel like when any question, true or false question says always, in the context of all 50 states, that should be a sign that it's false. But what does the rest of the team think?
I would absolutely agree with you on that assessment.
Yeah, me too.
Okay.
I would agree, and I like the way you got there. Yeah, that word always is terrible in a true false answer, or actually maybe it works to your benefit. So we're going to say that we want to see that answer being false. It's false. That's a gameplay.
Sure?
It's false. I guarantee you it's false. And that is why I'm the teacher. That is a false question. I promise you it is. And if I messed up the
So
game plan,
that'll be a test correction.
Exactly. That is you know what? I went and looked at your paper. Your parents yelled at me, and I was like, yeah, I missed that one. My bad. So extra credit. You're good to go. All right, Mark, play the board.
Let's see. Let's do red procurement.
Oh, man, y'all are going all out. Red procurement. Here we go.
Get the tough done early.
Makes sense. All right, so this question says, which of the following procurement processes allows state agencies to negotiate with multiple vendors after proposals have been submitted before making a final award? And you're going to have A, invitation to bid, B, sealed bidding, C, competitive dialogue, or D, fixed price contracts. And while your classmates are going at that, so Mark, tell me about this. You spent a year, 750 miles, I think I got that correct, above the Arctic Circle?
Yeah, I did a career in the Air Force. So one of my assignments was a remote tour in Greenland, which was Thule Air Base, but now it's Bidufik Space Base. So yes, it is located 750 miles north of the Arctic Circle, basic, pretty much on top of the globe there. So it was a unique experience. It was really cool. Yeah.
I'm assuming you didn't spend a lot of time outside.
Well, through the winter months, no. But during the summer, the highs get around 45 degrees, and you're basically in short sleeves after you've acclimated through the winter. So you're out a lot in the summer months, and that's when it's 24 hours of sunlight as well. So yeah, there's plenty of things to do if you want to do things.
Gotcha. Well, for someone who grew up in the South, just so you know, the Arctic Circle and Minnesota to me are the same thing. So anything far north is absolutely the Arctic Circle to me. So, all right.
Well, I'm in Colorado Springs today, and we have about 6 inches of snow. So yeah,
it is 75 in Atlanta, so that tells you the difference right there. Awesome. All right. Well, so what do y'all think for this particular question? What are you feeling is that procurement process? What do you think is the best answer given what's on the board?
I am thinking invitation to bid. Very similar to the RFP process. Sometimes they're just called different things, but that's where I'm leaning. Definitely open up to my teammates' input.
Yeah, I was thinking it was like post RFP and that maybe there was something. I was leaning C, but again, I really have no idea.
Yeah, I was thinking competitive dialogue myself, just the nature of being able to negotiate. But this might be a cheat code for us. I feel the least confident.
Certainly, because I'm on the federal side, so competitive dialogue is not really terminology that I'm familiar with. But on the state side, you may very well be. So I'm perfectly open to let's do a cheat.
All right, let's do a cheat. Well, since you're driving this one, Mark, what do you want to use? Would you like to use the Ask AI, peek at what your classmates came up with, or copy what your classmates came up with?
Let's let the classmates choose. Let's do a copy.
All right, we're going to do copy. And for what it's worth, your classmates a little bit split, but a majority went with C and said that they believe it's competitive dialogue. And for what it's worth, I tend to see eye to eye with them, if that's helpful.
Let's go with the classmates. I mean, they called it. So Yeah.
All right. We're going to go with show us C, which is competitive dialogue. There it is. Nice job. All right,
All
Jeff.
right. Thanks, class.
Yeah, exactly. That's 3 questions in. Way to go. All right, Jeff, what are we going to play on the board here?
We'll go back to the green. I'll do the green policy.
All righty. And that question available here is, and by the way, nice job, classmates, for giving the answer to the team. Forgot to thank you. All righty. So this question says, what does the Americans with Disability Act, ADA, require employers to provide to employees with disabilities? Is that A, free housing, B, reasonable accommodations, C, free transportation, or D, extended vacation time? And with that, Jeff, I don't know, like if you live in kind of a smaller town, larger town, but I know that you said it was yourself, your wife, and your kids were all born in the same hospital. Is that correct?
That is correct. It would be really interesting if it was all on the same day at different years, which it's not. But we all came into the world at the same place, which is kind of cool. We do live in a pretty big community, which just happened to be the hospital that we chose. So I couldn't think of another fun fact, so that one's a little bit boring, but it's interesting.
It's interesting. There's no fun fact that's boring. I thought that was pretty cool, to be honest with you. It made me think about, I cannot say the same. So, yeah. All righty. Well, here we go. You see the question here. What is it in terms of the group? What are y'all thinking for, really, what is that main requirement for the ADA? What do y'all think it is?
Pretty sure it's B.
Yeah.
Yeah, I would agree with you. I think B is the way to go on this one. So Let's see that answer. B, reasonable accommodations. Nice job. All righty. Kaz, we're going to roll it back to you. You see the board. Where you want to go?
Oh, let's do the last red, HHS workforce.
All right. Team 3, I hope you see how they're playing this game. They're going straight reds. All righty. Here we go. So the question on the board says, in the field of human services, what is the most significant challenge of the wraparound service model? Is that a lack of client interest in receiving services, inadequate use of technology in service delivery, limited funding for healthcare infrastructure in urban areas, or D, difficulty in coordinating between multiple service providers and ensuring continuous support for clients? So there's a lot to think about, especially for your classmates. So Kaz, you kind of talked about that you live in Vermont on a farm. Do you do a lot of like farm to table? Is that really kind of big in how you do things?
Yeah, we are providing for a lot of our own food. So we have goats and pigs and chickens. We've had turkeys. We have rabbits. We have a big garden. And so we're pretty close, I think, this year to having most of our food come from at least within 15 miles of our house, which is pretty cool.
Absolutely cool. Very sustainable. Very nice. All righty. Well, so you see the available answers here. What are y'all thinking? Which way are you leaning on this particular one? And you got 2 more cheats, just FYI.
I know. It seems a little, I'm looking at like B and D, but they seem a little subjective. I'm like, what? I don't know how the rest of the team is feeling.
I'm leaning toward D.
D, yeah.
That's where I was at too.
You still got 2 cheats and 2 questions left besides the $1 million question.
How confident do y'all feel in D? It seems like the right one to me too.
Yeah.
Okay.
Yeah, I think I like the way that y'all decided this answer. So let's see if we can do D.
We're not D's, we're C pluses.
Exactly. So you're already overachieving. There it is. Nice call. You got it. Difficulty in coordinating between multiple service providers. Awesome. Great job. All right. Mark, last question that you get to pick off the board. Where are you going to go with?
We'll do one of the yellow procurements. I guess one of the procurements. They're both
all
yellow.
Right. That question on the board that's going to pop over says, in a state government procurement process, what is the typical purpose of a request for information, the RFI? Is that to make the final selection of a vendor, to gather information about vendor capabilities before issuing an RFP, to negotiate contract terms with selected vendors, or D, to evaluate the quality of delivered services after contract execution while your classmates are, cheating off each other. Mark, tell me about the hole-in-one. Was this a recent thing? Has this been a few years? Where did you get this?
Yeah, it was recent, and I didn't think about it too much when it happened, but everybody, went crazy and thought it was a big deal. Yeah, I was playing, and it was a about 140 something yard par three, of course, and then it hit the front of the green, but then the way it went downhill, we couldn't see where the ball went, and I thought it like deflected off, and so we didn't see it roll in. So we're on the green, and there's like three of us looking for the ball, and one of the other guys is like walking up to like put in a 6-inch putt, and the ball is in the hole. So it was just pretty crazy. Yeah, it was this summer. It was in July. It was pretty cool. So yeah.
That's super recent. Awesome.
And I'm not a good golfer, so it was more luck than skill. So, but it happened, and it's pretty cool.
I'm not much of a golfer, but anything I do in golf is definitely luck over skill. I can promise you that. So, all righty. Well, you see what's on the board here. Kaz, Jeff, Mark, talk it over for a second. What do you think is the main purpose of that RFI?
Definitely B.
I'm with B as well. Yeah.
I think you're probably right on this one. All right, let's show that answer. Let's see if it's B. It is B. All righty. So you've now got $750 in the bank for the American Red Cross. So, doing well already. As you know, this is your last question of the day. I get to pick it, and it's the one in blue. So here we go for that $1 million question for the three of you. And this is playing for 1,000. What does the abbreviation FBAP stand for? Mark, I see you smiling. I feel like you already know.
No, I don't. I'm leaning back like I'm not sure.
Jeff, Kaz, any thoughts?
I don't know.
I think the F is probably federal.
You got it. That's a first step. I'm good with that so far. So I got you on federal. Maybe, what do we think on M?
I'm jumping out there. Federal.
Medicaid.
Maybe
Maybe.
medical?
Medicaid,
Yeah.
medical.
Medical.
Maybe medical. And then would you say what I'm doing right now is giving you assistance?
Is assisting us?
Is that what I'm doing? So there's that.
Programs, assistance program.
Percentage.
Well, I don't know. Whenever you get a score on a test, it's usually like a 75, 80, 90.
Percentage.
Percent.
So
percentage?
typically, right. So if we were to put it all together, we would say federal medical assistance.
Medical assistance percentage.
I think that's what. So, hey, y'all heard them. Let's go with that answer. Let's see if they're correct.
Yeah. Like I said, I don't work in the medical side of the house. So, yeah, it's a different world for me. I was not
the answer.
Sure at all.
Show it, please. Hey, we got there. So the three of you just won $1,000 for the American Red Cross. I hope you enjoyed playing. Y'all were great. You did the same thing as the first team. You dominated the board. I did like how you played the red. That was pretty awesome. And before you drop real quick, Mark, there was a question in the chat from Doug that said, after the hole-in-one, did everybody buy you drinks? And that is important.
So there wasn't a facility. Plus, it was pretty cold that day. So it had to be delayed. And yes. But yeah, after that round, it was like time to just go. Everybody was, fed up.
Doug said you had to buy drinks. I see, Doug, I'm not a golfer, so I didn't realize when you get the hole-in-one, you got to buy.
Yeah, the hole-in-one person has to buy the drinks.
Well, I hope I never get one. How about that? Awesome. Well, hey, congrats, team. And we're going to bring on our last players here, and they are called Definitely Not Smarter Than a Sixth Grader, and they're playing for No Kid Hungry. And Rachel, I agree with you. It's a terrible rule that you get the hole-in-one and you got to buy. Okay. All right. So with that, and since Rachel, I did certainly call you out right there, I'm going to start with you. Where on the board would you like to go?
Let's start with maybe a green one. How about HHS workforce?
All righty. First question for the day on the team 3. The question says, it's our good old true or false. True or false? The health and human services workforce includes professionals such as social workers, mental health counselors, and public health workers. So while your teams are taking a second, your classmates to figure it out, I want to know about this that you actually initially, before you became a dedicated HHS professional, you wanted to be on the Love Boat? Is that like sort of the same thing, like a participating on a Love Boat?
No, I wanted to work on the Love Boat. I wanted to
the
be a
actual
river.
Love Boat.
Yeah,
Okay.
I mean, child of the 80s, grew up watching the Love Boat and the reruns. And I just thought Julie had the most glamorous job. She was the cruise director. She just planned the parties. She wore nice dresses. She just got to kind of schmooze around. She had these quirky coworkers. That was my dream job. But then I realized that the real money's in state government. So here I am.
Exactly. The Love Boat don't pay.
That's right. I mean, you might get to travel the world, but what's that compared to state service?
Absolutely. I love your perspective. All right. Well, so the question on the board, and you've obviously got Tangeler and Reggie. What do y'all think? What is the answer here? And remember, before the gameplay started, for folks in the audience, Reggie was talking a lot of trash. So we got to see. Reggie, what is your team thinking for this particular one? True or false?
As a social worker for 30-some years, I feel like I've been included in this definition of the human services workforce. So I'm leaning towards true. Rachel, Tangular, what do you think?
I feel like Reggie's got a good background here. I think he's onto something here.
Yeah, I think I would agree with the team too. Definitely public health workers and social workers, on a broad perspective. So I support the team on true.
Did you see how we used our fine human services skills to come to consensus as a team? Beautiful.
Absolutely. I think that was great. Phenomenal. All right. So can you please show us that answer? We're going for true here. Exactly. It is true. Nice job. All righty. I'm going to turn the control over the board to you, Tangeler. What would you like to see?
You know what? I'm gonna go with the red one.
Yeah.
Let's pick policy.
Oh, even better, because Reggie's like, oh. All right, here we go. Our red policy question says, which of the following is a requirement for the able-bodied adults without dependents, ABODs, to maintain SNAP benefits? And that is, A, must volunteer at least 5 hours per week. Is it they must be enrolled in school full-time? They must have a valid driver's license, or they must work or participate in a work program at least 20 hours per week. And while your classmates are thinking on that, so Tangela, I got to ask you, you were a cheerleader in high school, but then you played 1 year of college basketball because you said you're 6 feet. My question is, did you play basketball in high school or just went straight from cheerleader to the hardwood? What did you do?
You know what? Thank you for asking, Jamie. I did. I played junior varsity and varsity. The story is I love to dance, but because I was so tall, they wanted to stick me on a basketball team. I was like, okay, we've got to have some compromise here. So they allowed me to cheer for the boys team if I played in the girls team. So that's how my basketball career got started.
Awesome. Hey, there you go. I love it. All righty. So the question in hand, what are we thinking that we're going to do here? What is the that following requirement for ABODs? Any thoughts, Reg? I see you smiling pretty big.
I'm smiling.
I'm going to definitely seek out feedback from the team. I'm familiar with the program, but not necessarily all of the requirements. I recommend that we go with D, but Rachel and Reggie, what do you think?
I started as an eligibility specialist, and I feel pretty confident about D.
I'm hearing consensus. Show us that answer. They're going to go
following my colleagues. Good call.
Teamwork makes the dream work.
It does.
Their answer seemed delightful.
I agree.
See where I did that?
I love
All
it.
right. Team
Nice
three.
job. And the hand raise. Thank you, Rachel. All righty. So we're going to roll into the third question here. Reggie, you now have control of the board. Where do you want to play?
Well, we've gone green, we've gone red. I feel like we should go yellow. And I kind of like the policy question. So let's stick with policy. Yellow policy, please.
Here we go. Yellow policy. And the question is, What is the main purpose of the Affordable Care Act, ACA? Is that to reduce the price of prescription medications? I wish that would happen. B, to provide free health care for everyone in the US. C, to ensure more Americans have access to affordable health insurance. Or is it D, to increase funding for private hospitals? So now, while your classmates are thinking on this one, Reggie, you still have an AOL email address. How long? That blew my mind. Did you have it back in the days when it did the and you had to like let
Oh
it
yeah,
20
ching,
minutes?
ching, ching. Remember
Yes.
that? I can even
Yes.
remember when they used to say, "You've got mail."
We're not
As a matter of
aging
fact,
ourselves, but I remember that as well. I completely
our
remember.
computer was in the same room that my second daughter was in when she was still in the crib, and among her first words were, "You've got mail." True story.
Absolutely.
Now I'll tell you, I choose to keep this until it becomes cool again.
Everything comes back.
And I've had it so long that I paid for it when it first came out. So I feel like I'm still getting my money's worth for it. There you go.
Awesome. All righty. Well, so you see the question on the board here, and Reggie, I know you said you like the policy, but kind of what are you leaning towards, and kind of with your teammates, what are they thinking?
Well, I'm leaning towards C. I know that when I was in state service in Colorado and the ACA came out, there was a lot of push of how we get a higher percentage of Coloradans to get access to health care, whether it be on the exchange or through Medicaid benefits or private insurance through employers. And so I'm leaning towards C, although there may be some benefits that have trickled into A, B, and D. I think C was the main purpose. What do you all think, colleagues?
Yes, I think C was the main purpose as well, but I'm open.
I agree. I don't think Reggie is leading us astray on this one. I agree.
Yeah, I think y'all should see this answer through. That would be what I would suggest. So, all righty, let's see. We're going to say the answer to this question is C. And there it is. All righty, nice job, Reggie. We're going to roll it back to Rachel. You're in control of the board. What you going to go with?
Let's see. How about procurement, yellow?
All righty, procurement yellow. The question we have on the board here says, what is one common procurement method used by state agencies to streamline purchases and avoid the lengthy RFP process? Is that A, open bidding, B, sole source procurement, C, competitive negotiation, or D, blanket purchase agreements? While your classmates are going, so Rachel, similar to Tangela, you're a cheerleader. So did you play basketball as well, or were you just a cheerleader?
You know what, Jamie? The reason I was a cheerleader, unlike Tangelier, is because I have absolutely no athletic talent whatsoever. So,
well, for the cheerleaders in the audience, it does require athletic talent as well. So come on now.
Yeah, well, yeah, I was more coordinated than athletic, so they let me on.
That's fair. That's fair. All righty. Well, so what do you think is the answer to this question? And remember, y'all still have cheats available if it's just even you want to see what your classmates are thinking. But how are you feeling on this particular one?
You know, I love me a sole source procurement. That's how I feel.
I was thinking that too, Rachel, but then
I agree. I know I've tried for some in times past as well. So
I'm not sure what a competitive negotiation is. So that was, or a blanket purchase. Well, I know a blanket purchase agreement is, but
do you feel like
I'm wondering if we should do a cheat.
Yeah, let's see what your classmates are saying here. All right, so when we get there, Rachel, you're in control of the board. Would you like to do a peek copy or the Ask AI?
I think let's do a peek.
All righty, so we're going to do a peek and see what those in the audience have to say. It'll pop up here in a second, I can tell you. So there's a lot of split here, but I can tell you that the most answered one is D, a blanket purchase agreement, which I know is not where y'all were leaning, but I think what I would say is I love my last name, and it starts with a D. And so just I share that with you if that's helpful.
I wonder if we should shift our answer to D and follow the class.
I feel okay with that. I feel like a cheat is worth it here.
All righty, we're going to use the cheat, agree with what they say, and we're going to say that it is D, the blanket purchase agreements. There it is. Nice job. Nice job. And good job, classmates. Way to make it happen.
Yeah, thanks, classmates.
All right. Down to your final two. Tangular, it is up to you to control the board now. Where would you like to go?
You know what? Let's try policy for green.
Policy for green. All righty. So the question on the board is the longest one. I had to read it the other day. Under the Child Abuse Prevention and Treatment Act, CAPTA, what is a key requirement for states to receive federal funding for child protection services? Is that A, states must provide free health care to all children? B, states must establish mandatory reporting laws for suspected child abuse or neglect? C, states must hire only licensed social workers for child welfare positions? Or D, states must offer free daycare services to low-income families? So there's a lot of options on the board. What are you thinking? Where does your gut take you first?
It takes me to B, but I definitely want to check in with my team members here on this one.
My initial thought was B, maybe C, but Reggie, maybe you've got some input here.
Well, I'll tell you, I studied child welfare practice in graduate school. This is my background, and coincidentally, the answer to this one is a little controversial these days. A lot of people are pushing back on the way mandatory reporter laws are being implemented across the country and the unintended consequence of more kids, particularly kids of color, entering the system because of these mandatory reporting laws. So I would suggest we go with your recommendation of letter B.
Okay.
I agree. Let's see B. And Reggie, thank you for that insight. That's really good to kind of share about some of the perspectives happening across the country. Nice job. All righty. And with that, the final question for your team to select, Reggie, you're going to have control of the board.
Oh gosh, this makes me so anxious. No one has done an AI question. The whole game, I don't think anyone has done an AI question.
All right, let's go.
Maybe there's a reason for it. So let's not get crazy. Let's go with the green AI.
All righty. So your question says, human in the loop is an important concept for enhancing accuracy, mitigating bias, improving transparency in decisions made by AI because it requires humans to train AI. It allows human verification and possible corrections to those AI outputs. It is a form of AI exercise where human minds go around in circles. Or it's D, it is a training approach in which human trainers go around the AI multiple times to teach a concept. I would argue this is not a green question, but you picked it, and here we are. So what do you think?
I agree. And we've decided as a team we'd like to go back for a yellow policy question, please.
Let's bring back the policy. Well, I'll tell you what, you do have a couple of cheats if you want to hit those up real quick.
Rachel, Tangela, do you all know about this one?
I don't. I would guess that it would be B, but I'm definitely open to some help here.
Yeah, I think we should do a cheat.
I agree.
All righty. Classmates, they want to know it. You want to do the copy or the Ask AI? I think it'd be funny to ask AI for the AI, but you could copy.
Maybe we should ask AI for the AI. I mean, I feel like AI should know this one.
All right.
All righty. So AI, we're going to ask AI if our wonderful AI voice can come on. Please give us a little insight into this question related to human in the loop.
Human in the loop is an important concept for enhancing accuracy, mitigating bias, and improving transparency in AI decisions because it involves human oversight and intervention in AI decision-making process. By allowing humans to review, validate, and correct outputs, HITL helps ensure that AI systems operate ethically, reduce risk of algorithmic bias, and produce more reliable and contextually aware appropriate outcomes.
All right.
That is the AI answer.
That feels like a long way of saying B.
That's what I was thinking. I agree. So what do y'all want to go with? AI is sort of, in a very long-winded way, steering you towards B.
Final answer.
B is final answer. Let's see B. It is B allows. All righty. You're 750 for No Kids Hungry. Got the final question. You know I own that one. The $1 million question. If we can see it, please. And this came up previous on another question, so you kind of have an advantage here. What does the abbreviation stand for? ABOD.
Able-bodied.
You're already there. Go ahead, talk it out.
I feel like it's able-bodied adults without disability.
I think the last one is without dependence.
Oh, you're right.
Yes.
You are right without dependence. See, this is teamwork makes the dream work, baby. I love it.
Absolutely. That should have been our name.
Right? The dream
Teamwork makes the
team.
dream work. Absolutely. Okay, well, I think a joint group there. I heard able-bodied adults without dependence. Is that what y'all heard?
Final answer.
Unless you have
Final
any
answer.
suggestions. Oh, yay.
All right.
You
Team
don't get
three.
suggestions. This was the $1 million question. Okay, with
Way
that,
to save us, Rachel.
exactly. With that, you have now won $1,000 for No Kids Hungry. We do
Nice.
appreciate your time playing today. Truly, to all three teams, we appreciate it. We love your participation. We hope that you will do it again sometime. You know, we enjoyed having all of you. And I just want to say I am completely grateful to know that each team got $1,000 for their charity. You all played wonderful. For those in the audience, you can see the QR codes if you have a second, if you wanted to learn a little bit more about the charities they were playing for, or to donate, whatever you feel comfortable with, that is on the screen. I appreciate everyone's time today, and I'm going to turn it over to our co-lead as well as our AI voice, Rupam.
All right. Thank you so much, everyone, for participating. We are at the top of the hour, so I won't make this long, but there are links, so you can use the QR code, or there are links in the chat that you can use. Thank you to our sporty participants, the wonderful audience, the Tri-Pepe Smith team for the background sound effect run of show, the special event work group, and our final host, Jamie DeMembrum. And with that, I won't take much of your time. Thanks for participating, and we'll see you soon at another HSITAG event. Thanks, everyone.